to undertake a preoperative COVID-19 test. However, for emergency surgical cases, as would happen in the case of road traffic accidents, as would happen in the case of complicated deliveries where a mother needs to have a cesarean section, it is expected that care would be provided without a COVID-19 test. However, this care needs to be in the confines of utilizing the current infection prevention control measures that have been deployed across the hospitals. Further to this, there are key recommendations for surgical clinics in terms of ensuring that they are safe, and there are options that have been provided when it comes to consultation. For example, the use of telemedicine options for screening outpatient elective patients. This therefore reduces the physical need for attendance at a surgical out clinic. However, for those who have to come in, there are measures when it comes to ensuring that there's appropriate spacing, sitting arrangements in waiting rooms, ensuring that all surgical clinics have hand hygiene facilities that are availed both for patients and service providers, and ensuring that the patients adhere to government protocols, particularly the appropriate use of face masks, and ensuring that where face masks are not available, the facility should provide them or the patient should come in with a mask. The mask should be worn appropriately, particularly during clinical interaction with the doctors, and ensuring that even this interaction puts in place physical distancing measures. We have done a review and continue to do reviews that will guide us in terms of accessibility to these essential services. And most recently, when we look at our NHIF data on surgical procedures, we note that there has been an adverse effect of COVID-19 when it comes to access to surgical benefit packages under NHIF. And when we compare 5 months before the pandemic to today, we note that there's been a decline. 5 months ago, NHIF would run about 44,528 surgeries and ensure the providers are compensated. However, during the pandemic, there's been a drop of almost 10,000 cases, coming to around 32,717. And that indeed is a cause of concern. And that's why we are here today to remind you that you can seek care when you need it, and there are mechanisms to protect you, particularly when you need elective surgeries. In terms of looking at our hospital burdens beyond NHIF, we've been able to look through, compare our major referral hospitals, Kenyatta National Hospital, which has operationalized 2 theaters specifically for COVID-19. And even there, we have seen cancellations in terms of elective surgeries. And we've been able to see that there's a decline across the whole array of type of surgical cases that are available. For instance, Kenyatta National Hospital, between March and July 2019, there were 9,598 surgeries done. And when we compare to the same period, we can see we are only at 6,180, another drop. And this is the same picture that we are seeing across our referral facilities. And so to make it clear, these services are available for emergency surgeries. Just to reaffirm and repeat, no COVID-19 test is required before surgery. However, when cases are elective, COVID-19 tests are required for all preoperative patients, and if positive, the surgical staff should be fully donned in the required personal protective equipment. Now, turning on to our COVID-19 statistics, today we have recorded 515 new cases, raising the country's total to 29,849. The new cases were drawn from a sample size of 6,353 collected within the last 24 hours. Of the new cases, 496 are Kenyans, whereas 19 are foreigners. The youngest is an 8-month-old infant, and the oldest is 92 years old. With regard to distribution by county, Nairobi leads with 251. Kitui comes in second today with 41. Kiambu, 33. Kericho, 23. Kisii, 19. Bomet, 19. Nakuru, 18. Homa Bay 16, Laikipia 12, Murang'a 11, Migori 10, Nyeri 9, Uasin Gishu 8, Kajiado 8, Mombasa 7, Lamu 5, Narok and Busia both have 4 cases, whereas Embu has 3, Machakos and Nandi also having 3, Nyandarua, Wajir 3 again, and Kakamega 2. We have provided the distribution in terms of county segregation, and that will be availed to you. In terms of our recoveries, we have 672 patients who have recovered from the disease, bringing the total number of recoveries to 15,970 so far, of which 65 are from various health facilities, whereas 607 are from the home-based care program. And we would like to thank our healthcare workers for this great achievement. Sadly, 7 more patients have succumbed to the virus, bringing our fatalities to 472. Na tunaendelea kutuma rambirambi kwa jamaa na marafiki ambao wamepoteza wapendwa wao. Asanteni. Time for questions and answers.
Thank you very much. Alphas Legat from Citizen TV. A question for you, Dr. Mwangangi, and also Dr. Kuria, you can also add your voice on that. Thermal guns have been the first line of screening for a couple of months here in the country. But again, we are alive to the fact that 90% of Kenyans are symptomatic patients. They don't exhibit unusual temperatures, and perhaps, and these, you go to public installations, corporate entities, they use thermal guns as the first line of screening. Without ruling the importance of these thermal guns, is it a flawed process, or rather, is there an option or alternatives that can be used to screen patients? Thank you.
Nancy Okware kutoka KBC. Umezungumza kuhusiana na wale wagonjwa ambao wanahitaji matibabu pengine ya upasuaji kuelekea pale hospitalini, na vile vile kuna wale ambao wanaugua magonjwa mengine, na katika siku za hivi majuzi kama wizara mmekuwa mkitoa wito kwa wananchi kutoogopa na kwenda hospitalini kupata matibabu. Je, kufikia sasa hivi ripoti kutoka upande wa hospitali ni ipi? Je, Wakenya wamekumbatia ule wito ambao mmekuwa mkitoa ya kwamba ikiwa wanaugua basi waelekee pale hospitalini? Na vile vile Wakenya wamekuwa wakiuliza kuhusu sampuli ambazo zinapimwa katika kaunti. Hivyo basi ikiwa itawezekana katika taarifa za kila siku, ikiwezekana tupate sampuli katika kaunti, tutashukuru. Asante.
Thank you, Nancy, and thank you for the previous question. Yes, we shall be able to avail you the samples of each county. In fact, we have them today. We can give you the set, and usually from this you're able to, calculate what the positivity rate looks like for each county. So that information is available. Concerning back to the first question, the issue of thermal guns and the screening procedures. It's important to note that Kenya has employed mechanisms when it comes to screening that are actually endorsed through the World Health Organization. And yes, you're correct that it may be that sometimes the use of a thermal gun might not be able to pick up a positive case. However, different studies have shown a level of utility for putting in place these screening services. And so we feel that following the guidance from WHO, we shall continue to adopt this, particularly in areas where there's a lot of human traffic, in the malls, in the airports. This is a measure that can actually be useful, particularly for the most, should I say, afflicted patient who is demonstrating the high fevers and other symptoms. Yes, it is true. 90% of our patients are asymptomatic, meaning we would possibly miss them through that mechanism, but that does not invalidate its use, because you could also possibly pick a positive case. With regards to Nancy Okwaro's question, I'll ask Dr. Kuria here, who will add on to this in terms of the response. As we were preparing our brief for today, I'm informed that there's actually now an upsurge when it comes to normalization of cases. We're happy to report for antenatal care services. It seems mothers have now started going back. We're happy to report even for deliveries in a hospital. Mothers have started going back to deliver in a hospital. Particularly impressed with MTRH, Eldoret Hospital, where their surgical bookings are continuously now coming back to normal. So yes, Kenyans have had, but we need to emphasize and remind them that these services are available and that they should not be afraid. I'll ask Dr. Kuria to add on to this, Dr. Ari.
Yes, indeed, Okwaro. It is true that studies done by the Ministry of Health through the month of March through June, through May, had shown an initial decline in attendances in hospitals, and there are several indicators that were used to do this analysis, and most of them are based on OPD attendance, first ANC attendance, and the three doses of DPT given to children, and the number of children under 5 presenting to hospital, and also the number of children presenting with pneumonia-like symptoms. There was an initial decline noted in these cases through the months of between March and May. But between May and June, there has been shown an increase or improvement in attendance in these facilities. So as proof indeed that indeed Kenyans are heeding to our call that these services are available and they are safe. Of note is an increase in the number of what you call skilled deliveries of pregnant mothers and delivery of children. There had an initial decline through May, but a slight increase between May and June. Bed occupancy rate has also declined, and you're seeing now an slight increase in bed occupancy across all referral hospitals. Of importance here is to encourage Kenyans, as it here indicates, to continue seeking these services in our facilities. They are available, they are safe, and more so for surgery, where there are initial studies and initial recommendations against surgery. We are continuously encouraging surgeons to continue doing their surgeries and taking extra precaution, of course, as they conduct their surgeries. So I'm from a hospital right away, and I've seen a case actually in theater, and surgeons actually conducting their surgeries as usual as we speak. So surgeries are indeed ongoing, and they are safe, but what we're encouraging surgeons is to ensure for elective surgeries, play safe, at least do a COVID-19 test before elective surgeries. But for emergency surgeries, as long as you take your precautions, put on your mask, N95 mask, and also the patient, the abnormal thing here is, I'm a surgeon myself, and all I know is initially, or before COVID, we never used to advise to have patients wearing masks. But today, our patients are also wearing masks, just as the surgeons. So the surgeon wears an N95 mask, or the patient wears a surgical mask. But yes, these surgeries are safe, as long as the surgeons take precautions, even when there are no COVID-19 tests, especially for emergencies. Thank you.
Asanteni nyote.